Good afternoon. Thank you for joining us for this update on COVID-19. I'm Tina Friesdecker, President and CEO for Spectrum Health. As a community, we have done a great job in coming together to limit the exposure to this virus and to keep people healthy. I realize that it's been very hard on everyone, but we can't let up. We are now seeing our hospitalization and case numbers and positivity rate increase. And we know to keep things manageable, we need to continue the best practices that work: wearing masks, washing hands, and watching our distance. Today, I'm joined by Dr. Daryl Omuchi, President of Spectrum Health West Michigan, Dr. Lauren Hamill, President of Spectrum Health Lakeland, and Dalia Kuhn. She's a pediatric infectious disease physician. We want to ask each of them to give a comment on what we're seeing in West Michigan and Southwest Michigan, and offer thoughts on best practices, treatments, and the prospects for a vaccine in the months ahead. So Daryl Omuchi, could you please start with what you're seeing here in West Michigan?
Sure, thank you, Tina. And I believe we have some slides to show. The first, which, there we go, is really showing you what I think the picture we're seeing over the last week to 10 days. This is a busy slide, but pay attention to the boxes. And this shows our averages of inpatients or hospitalized patients with COVID-19 across our hospitals within the 13 counties surrounding Grand Rapids. And you can see in late May, we peaked in the mid-60s with patients that were admitted with COVID. That was really our first surge. You see that over the summer months, we were really sitting between about 15 to 30 patients. And over the last week to 2 weeks, we've seen those numbers increase significantly. This is as of a couple of days ago, and we're actually a bit even higher now. So this is causing us all a cause for concern. If you want to move to the next slide. And this is really what you should focus on. You know, I think by now we all know how important COVID testing is, and this is specifically the PCR testing that tests for active disease. And this graph shows the average percent positivity of the testing that we do. And for many months, while we were performing thousands of tests per day, on average about 3,000 tests, we saw the percent positivity somewhere between about 1 and 3, occasionally up to 4%, but really averaging in the 2 to 3% range. And you can see that trailing the end of September and really the beginning of October, that percent positivity started climbing. And over the last 3 days, we've had a percent positivity really right around 6%. And on 3,000 tests a day, that's a lot of people coming down with COVID-19. Next slide, please. And this is just a bigger graph of hospitalizations within Kent County specifically. This includes Spectrum Health, Metro Health, as well as St. Mary's. And this only goes back about 5 days ago. So those numbers are significantly increased since. But you can see in late May, all of the health systems in West Michigan, in Kent County region at least, had significant COVID patients. And you see how that fell off and then started climbing. And I can tell you, I was in contact with both Metro and St. Mary's this morning. Their numbers have increased relatively substantially as well. And that peak on the right would look much more like the May peak for all of us than it does now. Next slide. I'll turn it over to Lauren.
So these are the numbers for Berrien County in southwestern Michigan, and the numbers are smaller, but the trends are identical to what Dr. Omuchi was just describing. You'll notice the graph in the lower right-hand corner. Those shows COVID cases per day, and we now are having more COVID cases an average day than we did in our previous peak back in May and April. So definitely more cases, definitely more hospitalizations. Fortunately, patients are a little younger, and so the mortality rate has not picked up yet. But of course, we're concerned that that may follow. I'll take the next slide. This is the inpatient hospitalizations, and you can see we had a peak earlier in May, and we're trending north again with hospitalizations. Those increased significantly again today, which are not represented on this slide. Next slide. So how do those trends compare across the world, across the country, and in Michigan and closer to where you live? Well, you notice in Michigan, we have about 2.5% of the population that has tested positive. That's the third row there, have tested positive for COVID-19 since we began testing. That means about 1 out of 65 of us in Michigan have tested positive for COVID-19. Now, the good news is for those in Michigan, there are 38 states in the US that have more COVID cases per 100,000 residents than Michigan. So we're better than some. We're about the same as the rest of the Midwest. You notice in Kent County, 1.7% have tested positive totally, and in Berrien County, 1.3%. And you can see COVID deaths and the case fatality rate for both Berrien County and for Kent County. Kent County is just really doing superbly in keeping the mortality rates low. Berrien County got hit hard and early with nursing home deaths. That rate now has fallen since it's younger people that are getting COVID now. But that's kind of a perspective on how it's going across the world and near you. I think back to you, Daryl.
Thanks, Lauren. And so here is our publicly facing dashboard. This really gives everyone in the community a chance to go to our spectrumhealth.org website and see this data, which is updated daily. As you can see in the upper left, we have 81 inpatients amongst all of our hospitals within Southwest Michigan and in St. Joe, Lakeland area with COVID. If you go a step down, you can see we track our employees. We both have a screening tool to ensure that our employees only come to work if they're feeling healthy, and we track our employees that test positive. You'll be happy to know that our positivity rate for employees remains quite low, and when we trace those, we find the vast majority are community spread. And then most importantly on this test is that COVID-19 lab testing tab on the bottom left, and there you can see our rolling average percent positivity on that lab test at 5%, and yesterday's was 5.8%. This is the trend that really is worrisome because it predicts not what's happening today, but what might happen in 1, 2, 3 weeks from now from a hospitalization standpoint. And then finally, I'll call your attention to the bottom right, the antibody testing. The cumulative antibody testing, that really tells us for all the people that we've taken their blood, what percent were positive for COVID antibodies, and that's about 3.6%. So when we hear discussions about things like herd immunity, it's very important for us to take the data that Dr. Hamill shared and data like this to recognize that in our communities at present, the actual amount of people or number of people that have had COVID and have some sort of immunity to that is likely quite low. And to get to herd immunity would be a huge jump from here. Next slide, please. And so this is our surge modeling. And for those of you that joined our conversations back in March, April, May, this is going to look a lot different because we've learned a lot over the last few months. And essentially what we've done now is we predict 30 days out. Predicting anything beyond 30 days really has so much potential for error that we have stopped doing that. On the left are hospitalizations within the 13 counties surrounding Grand Rapids. On the right are hospitalizations at our Lakeland hospitals. When you start seeing that black line and you follow that along, that is the most likely number of hospitalizations. But with this increased positivity, we can model out the kind of highest amount we predict and the lowest amount. And the highest would be the red line and the lowest would be the blue. And you can see in West Michigan, we predict over the next month, we could have up to 200 inpatients in our hospitals with COVID. And in Lakeland area, we could have a little over 60 patients. While that is a lot, and our hospitals are quite full already with patients without COVID, we have actively planned and prepared for having more patients, and we definitely have the capabilities of taking care for these people. Next slide. And then finally, and you'll hear this throughout, I'm sure you'll hear this from Dr. Kuan, and you definitely heard it from Tina already. There are many potential treatments out there for COVID, and we've gotten better. There hopefully are vaccines on the horizon, but we absolutely know from the science and from our own experience that masking, social distancing, hand washing is vital. And in spite of some changes in executive orders recently, we are still maintaining visitor limitations in our hospitals and our ambulatory clinics and our nursing homes to protect patients, to protect visitors and their families, and to protect our staff. And with that, I'll turn it over to Dr. Kuan.
Thanks, Daryl. And I would just add on to what Dr. Almucci was saying in regards to social distancing, helping with preventing COVID-19. It will also help us prevent other respiratory infections such as the flu and many of the other respiratory infections that we're about to head into the season for. And many of those viruses look just like COVID-19 and can be challenging to separate out. So staying healthy in all regards will help us, decrease the number of patients who are just sick overall. So in this slide, you'll see that we have some plans here for more permanent structures for testing collection sites. The drawing represents the 1300 Michigan testing site, and the upper right-hand corner is Ludington, and the bottom is Big Rapids. As the winter months approach, we do have need for more stable structures that can withstand wind and extreme weather better, and so these will be put in place so that we can have more secure shelter for collecting and especially protection for our staff members and our patients. Next slide. Thank you. So in addition to this, we will also be offering new and creative ways to make sure that we are keeping our population safe. So this would include vaccinating our patients and getting them vaccines in a safe manner. So to encourage more Michigan residents to get a flu shot, Spectrum Health has launched one of the Midwest's first curbside vaccination programs. The hospital piloted the program at select locations this past summer, and it has now more than 40 sites operational in West Michigan. So there are several benefits to having a curbside operation. The first is that there's no time spent indoors in a waiting room. It's offered to patients of all ages rather, and then it provides many immunizations, including childhood immunizations, which of course I, as a pediatric infectious disease doctor, am especially concerned about these lower rates that we're having during this pandemic, as we have had a need to decrease our patient visits. It's also been helpful for patients who have mobility challenges and as they can stay in the car. And Spectrum Health has already provided hundreds of curbside visits, with most appointments lasting less than 10 minutes. In addition to vaccines, we'll also offer blood pressure checks, B12 injections, strep tests, etc., that can easily be offered at the curbside. Next slide, please. So in speaking about vaccines here, you all have probably heard about the number of vaccines that are currently in test. There are multiple vaccine trials out there from many, many different countries and using different platforms. Some of them are novel and that have been that the vaccine community has been working on. And so that's extremely exciting. So it looks like there's 25 total that are in phase 1, which means that they're looking at just the safety of the vaccine. In phase 2, in some limited efficacy, and then phase 3, where we look at the efficacy over a larger number of patients, of people. And then so far, we don't have any that are approved, but with so many vaccine trials and with so much effort in looking into this, that we hope to have a viable vaccine soon. Next slide, please. Here at Spectrum Health, we are working actively to make sure that once a safe and effective vaccine has been made available, that we will be working to store it safely, to make sure that we have an adequate supply for our community, our staff, and our patients, make sure that the vaccine is safe to give, and ways to administer it that will limit exposure to COVID-19, and we'll make sure to communicate that plan to the public at large. That's all I have to say, and so I'll turn it back over to Daryl.
I think it's Tina's turn now. Tina, you're muted.
Thank you very much. We wanted to take your questions and answers and be able to answer some of your questions here. So feel free to put it in the chat box of the media area that you're using. One question that came through for Dr. Kuhn is, what's this new virus that mimics COVID-19?
I'm not aware of
kids?
what virus you're specifically referring to, but I will say that COVID-19 mimics a number of respiratory virus, flu included, so that the symptoms and the syndrome that is associated with COVID-19 is not unique to that, and it's very difficult to differentiate amongst the different viruses, respiratory viruses that we'll be seeing this flu and cold season.
Thanks. So one of the questions says that many people have expressed reluctance to use facial coverings out of concern for oxygen deprivation or respiratory infections. Has the hospital or our providers noted any change in the occurrence of these issues since the facial covering requirements went into place?
I'll take that one. So actually, we've spoken in depth with our allergists and our pulmonologists. Our allergists and pulmonologists both see a significant number of asthmatics. Pulmonologists, of course, see several patients who have baseline oxygen needs, and cystic fibrosis patients whose lungs aren't normal. And what they've noticed is that there's no drop in oxygen saturations with wearing facial coverings. So we don't have a concern for that happening at this time. So you should feel confident in wearing those facial coverings.
Thank you, Dr. Cohen. One of the questions is, we're hearing that ICU capacity has tightened up recently as COVID hospitalizations have increased. Are you taking this, is this situation serious? I think Daryl commented on the ICU capacity, and we are taking it serious. Daryl, or Dr. Milchi, would you like to comment on that?
Sure. Yeah. So starting usually around this time of the year, and definitely getting into the winter months, we always have ICUs that are relatively full. It's the nature of what happens in West Michigan with flu and other illnesses, coinciding with people having heart attacks and other type of surgeries and problems. And so we are seeing that a bit earlier now, where we're seeing a fair amount of people without COVID in our ICUs. And that clearly is what gives us the impetus to really plan a lot for an influx of COVID patients. And the beauty of having many months to do this planning is we have very diligent plans of how we can expand outside of even the four walls of our ICU into other portions of our hospital to provide that high level care should the need arise. So I would not say that we are worried, but I will say that we are watching it very closely.
Thank you. Another question is there specific planning being done, especially in regional areas? We've talked today about what's going on in the Lakeland area, Berrien County, and Kent County. But our service, when we talk about this, we think about the entire west side of the state here. Dr. Amochi or Dr. Hamill, would you like to comment on what we're doing with other areas?
Sure, I can take that one if you don't mind, Lauren. So, one of the beauties of our community is we have really great hospitals embedded within so many of our smaller communities around these 13 counties. And those hospitals are full service hospitals with capabilities that are really excellent, and COVID has only sped that up. So one of the things I would say that I think has been our best accomplishment is we've now completely stood up what we call a virtual ICU. And so we have great ICUs already in our regional hospitals, but if we need to have extra specialties involved, specialties that we really don't always have in smaller hospitals, we can, with very high-tech video equipment and technology, connect specialists to patients in those ICU beds and render advice and care remotely. And the goal would be to shore up and render care locally to make sure that we're providing the best care possible. I'll make one other comment there, that we are in constant contact with all local health departments and really have partnered with them. We tend to provide the most testing of just about anyone in all of the regions that we serve. And so it is really contingent on this partnership that will keep our public safe, and we're really proud and happy to be participating.
Thank you. Dr. Hamill, can you comment on hearing that patients may have gotten COVID a second time? What's going on there? And then have we seen that at Spectrum Health?
Yeah, there are a number of reports that folks that got COVID once did not make antibodies that stuck around. And if your antibodies disappear, you have no protection against a new case. There also have been reported mortalities on those second cases. That's one of the concerns, of course, also for the vaccine. Will the vaccine give long-lasting antibodies? We certainly hope so. So just because you've had it once doesn't mean you're not susceptible to get it again. And just because your antibodies have been measured doesn't mean those antibodies will last a lifetime.
Is there any advice for the upcoming holidays in terms of travel or gathering with family members?
Be very careful. You know, hand hygiene, social distancing really works. You know, when you're around your pod, your group, exposed to each other every day, and everybody's being careful, you know, it's controlled risk. You know what that risk is. There are so many cases of folks getting together with family from out of state they haven't been hanging around with routinely, and then passing COVID to everybody. I recently made a trip to the West Coast, saw a granddaughter and a daughter I haven't seen for a year, and it was sad, but I didn't hug them. You know, it was an air hug from a distance. I would certainly encourage everybody to be very careful. It's not just your risk, but it's the risk of the folks you hang around with, and some of them may be very vulnerable to the impacts of COVID-19. So be really, really careful.
Thank you. Dr. Cohen or Dr. Amuchi, have you seen anything coming out of schools? How are schools doing and learning going so far?
Daryl, I can take this one. So it looks like we have had pockets where children have had to be quarantined, either because there was a staff member that was positive or there was a potential exposure. But actually, Kent County has informed us that the rates of positive tests in the Kent County School District has been surprisingly low, and are very optimistic about it. So overall, schools are doing well. Personally, in talking to my daughter's teachers and her school system, there has been not much resistance from the children at school, and that they've been following the rules and wearing their masks. So I think that's really, really been beneficial for these low rates that we've been seeing.
Okay, thank you. The next question is one that Daryl and I talk about, I think, every single day. Are we noticing any specific trends in our area that are due to or is the reason for the spread to COVID-19?
Yeah, so let me talk about one that I think is really worrisome, and then one trend overall that I think is quite good. The worrisome trend, and we're all saying this because we're all tired. It's been, you know, more than half a year, and it is hard to wear a mask, to distance, to really be vigilant about this. And there's obviously a lot of information out there that can be confusing to folks. So we have seen, even amongst people that we know quite well that are in the healthcare field, a kind of lapse in some of the protocols that people adhere to early on. We've seen, you know, non-sanctioned homecoming events with 100 kids in a small room, and these type of things can lead to more and more spread. So just like Dr. Hamill said, and really all of us said, really sticking to some of these basic principles is probably the best thing we can do. As far as an overarching trend, and not necessarily about the cause, but an overarching trend that I think is really a testament to the state of Michigan and to so many of our local communities and leaders. Early on in COVID, we saw a markedly higher rate of underrepresented minorities with COVID positive cases and with hospitalizations and deaths. And thankfully, over the last few months, that really has come down. And now we are seeing a much more equitable distribution of COVID, so to speak. And so that is what I would view as a big win in an otherwise really challenging situation.
Thank you, Daryl. I'm not seeing any more questions coming through from LinkedIn or Facebook or other media. And so I just want to say thank you for joining us. We appreciate everything you're doing to remain informed. Please stay focused on those best practices that we shared before: washing your hands, wearing masks, and practicing social distance. This is what we can do to limit the spread of the virus. And by working together, we can really accomplish this to keep our families, our neighbors, and our community healthy and safe. Thank you so much for joining us today. And I want to say thank you to Dr. Daryl Amuchi, Dr. Lauren Hamill, and Dr. Delia Cohen for joining us today to share your expertise and what's going on. And we hope everyone has a wonderful day. Stay healthy.